Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to go over some hip mobility exercises. So a lot of times it's really common in the morning to wake up stiff. It can impact a workout routine if your hips feel kind of icky. Even if you don't feel that they are constricted, they can still be constricted. And I like to tell everybody a quick test to see this is all you have to do is sit down and just cross your ankle over your knee. You're just going to let your leg sit where it is and do the same thing on the other side. They should be symmetrical and they should actually go parallel with the floor. Mine's a little bit short, so it's indicating tight hips. A lot of times what we see is kind of this on one side and this on the other side, or somebody who can't even get their foot up their knee. That's indicative of a really tight hip, and while it may not be painful, it may not affect you right now, it certainly plays into low back pain, hip pain, hamstring, tears. All sorts of issues can stem from this hip stiffness. So even if you aren't experiencing any sort of hip pain right now, it's something that you really want to incorporate. And the nice thing about hip mobility exercises is, you can do them right before you work out. You can do them throughout your day to really help loosen up. So the first one I'm going to show you is exactly, we're going to turn that test into an actual mobility exercise. So you can bring that foot up, across the ankle over the knee. You can push down a little bit if you want. You can actually cradle this leg, all right, to get a little bit more of a stretch. You want to pull up on your ankle if this is what you're going to do. You can sit up nice and straight and lean forward, okay? Couple of different ways. All of those combined will help really loosen up that hip. You don't want to necessarily run through them like I just did. You want to be there for about 30 seconds, but you can really kind of move this throughout the day, and it's a really great hip opener to do. You also want to make sure that you're doing some type of what we call assisted tissue mobilization. So I have a little beastie ball here. You want to put this underneath your butt and kind of roll it around. Now this isn't really a stretch, it's going to break up some of those tender points. If you have a foam roller, it'll do the same thing. But you really want to make sure that you're getting this kind of all the way around your hip and your glute area. That's the difficult part about the hip and the mobility exercises, is it's such a broad area that you want to make sure you're opening up everything. The next one I'm going to show you is just a simple side lunge. Now the idea with the side lunge is your toes are straight ahead and this leg is bent, this leg is straight. Okay? You're going to feel it opening up into here. Again, this hip complex is a large complex. You want to get the inside, the front, the outside. But nice and easy, just do a side lunge. And then what you can do is then you can do a forward lunge. Now you don't want to do a typical forward lunge like you're working out at the gym. You want to keep your back heel down. You want to bend your front heel. Make sure your hips are pointing forward. That's going to help that hip flexor. And again, this one you can do a couple of simple repetitions with if you want. If you're really advanced, you can pull this leg up. You might get more of a quad stretch with this, which is that muscle in the front, so you may not feel it in the hip flexor, which is why this is a good way to start. But again, if your hips are turned this way, like I am, you're not really going to feel it in the hip flexor. So you want to really push forward with those hips. Make sure your back is nice and straight, and you're doing this. These are all ways to loosen your hip up, and it's really important that you do them throughout the day. Just doing them for 5 minutes like I just showed you is not going to be effective. You want to make sure that you are incorporating these throughout the day, which is why I kind of showed you one sitting, a couple standing. You don't have to do these in succession if you don't want to. You can do them at any time. If you're standing at a counter, if you're sitting at your desk, that's going to help open up that hip capsule and keep it open, which is really important for low back health, knee health, everything kind of in that lower extremity. If you or someone you know suffering with hip pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.